Dr. Jashwant Kumar Sinha, a leading implantologist in Kolkata, joins us from yours truthfully, Full Mouth Rehabilitation and Implant Center. Sir, thank you so much for being here at the etnow.in Health Ranking and Conclave. How are you?
I'm fine, and thank you, ET Now, for inviting me here.
Absolutely. And sir, today, conversations around full mouth rehabilitation or around implantology are becoming all the more common, right? Can you tell us more about how implantology as a field has evolved over the last decade or so, and what does full mouth rehabilitation actually constitute?
So, to understand the full mouth rehabilitation, we need to know that rehabilitation is something like recreating the original.
Right.
Okay, and this like human body is a complex engineering created by a god.
Sure.
And to recreate that is a very tough job. Now, when we do full mouth rehabilitation, we do full mouth rehabilitation when there are multiple missing teeth and the bite function is so damaged that we need a planned and holistic approach to restore the chewing function, the oral health, and the confidence of the patient.
Absolutely.
So now, earlier, a decade ahead, before, it was very tough because we were having 2D images, we were having manually operated lab where, to rehabilitate in a holistic approach, it was not feasible. Now it's an era of digital era,
right,
where we have got 3D images, we have got CAD/CAM, we have got, guided implant surgery, and before touching the patient also, we can plan everything and we can recreate the same in the patient's mouth.
Sure.
With more precision and more predictability.
Well, thank you for sharing that. And as per your point of view, doctor, what do you consider to be some of the most commonly made mistakes when it comes to oral health?
So I will say it's intervention.
Sure.
So patients are actually unaware ki when to go to a dentist.
Right.
In India, patient come to a dentist when they have pain.
Sure.
So pain means you have lost your enamel, you have lost your dentin, and the third layer had been intervened.
Sure.
So we need to make the patients aware that at least they should go for a periodic checkup, or else you get a signals like bleeding gums or tooth or food stucking in between teeth. I will say one more thing. I'll add to it one more
Please.
thing. Like lots of patients says that I'm brushing twice a day, but still I am having dental problems.
Right.
Because they don't know the proper technique. It's
Sure.
always the technique you have to know, how to brush. Then only you can clean the surfaces.
Makes
So
sense.
we are cleaning the surfaces which are visible, but what we are doing for the interdental area, we never floss in India. At least in India, I don't know. Hardly, 10 to 15% of population is doing so.
Right, right. I think you've bring up some excellent points. And, thank you for essentially bringing the conversation closer to home in the Indian market. And speaking of which, now let's talk about Yours Toothfully. Now, in the city of Kolkata, Yours Toothfully has really built a reputation as an incredibly specialized center. In your vantage point, what are you doing differently? What's your clinical approach, and what makes it stand apart from the rest?
See, it's obviously the man. So doctors are very important, but human error is always there.
Right.
So we are evolving how? We are including the technologies which are present so that we make it more predictable and more advanced.
Sure.
And Yours Toothfully had been always, they have opened their hand to inculcate the newer technologies. So we were the first in the eastern region to have chairside scanner, chairside CAD/CAM.
Sure.
And a milling unit, lab milling unit. So when you come to Yours Toothfully, we make sure in a single visit, we can do a RCT followed by a crown. You can see your crown being made.
Right. Phenomenal. Well, I think that makes for a wonderful segue into my next question, which is what are some of the clinical innovations or the technology innovations in the field of full mouth rehabilitation or implantology that you are most excited about?
So AI, we had been talking, I have been listening to all the speaker here, they were
Right.
talking. So AI is evolving in the medical field also.
To say the least.
So when we do recreation, we want to know what was there initially with the patient. and EI will play an important role in that. So EI-driven planning and execution would be very important. I will love to see that. Then it's called real-time dynamic navigation. So when we are placing an implant, we are having 3D right now or a guided surgery. So in real-time navigation, what will happen now? Ki when you are drilling or doing a surgery in the particular space, they will guide you where the nerves or blood vessels, all the important structures are.
Sure.
Okay, so it will be easier for you.
Right.
You don't have to be like, you are not doing any more blindly. You are knowing everything what is going to be done.
And the hope is this would only improve patient outcomes and minimize doctor error.
And most important, the time and less of trauma.
Correct. Which of course has a direct impact on recovery time as well and downtime as well.
When it is minimally invasive, it's always the recovery time is more less.
Now, doctor, when it comes to fitness or when it comes to nutrition, they play such a pivotal role in the context of preventative healthcare. Can you perhaps drill down a bit deeper as to the role it plays in the context of oral health more specifically?
So, see, I never say to my patients ki for oral health you don't take these things.
Sure.
See, you can take every damn thing, but you need to know ki how to maintain them.
Right.
So proper brushing, proper oral health maintenance is required for that. So you need to get aware with that.
Well, doctor, thank you so much for taking the time to really debunk some of the leading myths that surround full mouth rehabilitation. We congratulate you, we salute you on all your efforts, and thank you for being a part of the ETnow.in Health Ranking Link Conclave. Thank you so much.
I'm really privileged to be here, and thank you so much.
Absolutely.